Men over 60? I know this sounds absolutely insane, but your toothbrush, yes, the one sitting in your bathroom right now, can give you instant hardness in less than 30 seconds. I'm not joking, and I'm not talking about using it on your teeth. There's a specific spot on your body that when you stimulate it with your toothbrush for just 20 to 30 seconds, it activates a nerve pathway that floods your penis with blood almost immediately. I'm Dr. Jocelyn, and what I'm about to share with you today is backed by real, peer-reviewed science. It costs you absolutely nothing, and it works the very first time you try it. No gimmicks, no expensive gadgets, no prescriptions. Just your own body and a tool you already own. But here's what I need from you. I need you to watch this entire video start to finish. Every single minute matters. Because if you stimulate the wrong spot, if you use the wrong technique, if you apply too much pressure, or if you skip any of the steps I'm about to walk you through, it simply won't work. And I don't want that for you. I genuinely want you to get real, noticeable results tonight. So please, stay with me through every step. Don't skip ahead. Let's go. Before we dive in, do me a quick favor. Hit that subscribe button and drop a comment below. Tell me honestly, have you ever heard of this technique before? I'm guessing the answer is no, because almost nobody talks about it. Not your doctor, not your friends, not even most urologists will bring this up during a regular visit. And that's a shame, because what I'm about to teach you could genuinely change the way you experience intimacy for the rest of your life. Now, I want to take a moment before we get into the how-to, because I think it's really important that you understand the why. And more importantly, I want you to understand that you are not alone in this. As a woman in medicine, I've spent over 15 years listening to men open up about their most private struggles. And I can tell you something that might surprise you. Erectile dysfunction is one of the most common conditions I see in men over 60, and yet it remains one of the least talked about. The silence around this issue is staggering. Most of the men who come to see me feel completely alone. They feel embarrassed. They feel ashamed. Many of them have spent years avoiding intimacy because they're terrified of failing in the moment. They've watched their confidence erode. They've felt their relationships suffer. And the emotional weight of that, the quiet desperation, it's something that I take very, very seriously. I've had patients sit in my office, strong, accomplished men who have built businesses, raised families, served their communities, and they can barely make eye contact when they tell me, "Dr. Jocelyn, I can't perform anymore." And every single time, my heart goes out to them. Because I know that behind that admission is years of frustration, years of feeling like their body has betrayed them. Many of them have tried pills, pumps, injections, all sorts of expensive interventions. And while those tools have their place, so many of these men still feel like something fundamental is missing. They feel like they've lost a part of themselves. What breaks my heart the most is that so many of these men don't realize a crucial truth. Their body still has the capacity to respond. The wiring is still there. The nerve pathways are still intact. The blood vessels still function. They just need the right kind of activation, the right spark. And that's exactly what this technique provides. So let me explain the science first, because if you don't understand the mechanism behind this, you won't do it correctly, and you'll dismiss it as nonsense. And I promise you, it is not nonsense. Here's what's happening inside your body. Between your scrotum and your anus, there's a small, often overlooked area called the perineum. Most men go their entire lives without ever paying attention to this spot. They don't know it exists, they don't know what it does, and they certainly don't know how powerful it is. But underneath that skin lies one of the most important nerve structures in your entire body. It's called the pudendal nerve. And if you remember nothing else from this video, remember that name, the pudendal nerve. This nerve runs directly through the perineum, and it is responsible for sensation in your penis, your scrotum, and your pelvic floor muscles. It is one of the primary nerves that controls erection function. Without this nerve firing properly, achieving and maintaining an erection becomes extremely difficult, regardless of what medications you take. Think of the pudendal nerve as the master switch for blood flow to your genitals. It's the gatekeeper. It's the one that tells your vascular system, "Open the gates, let the blood in." When you apply targeted stimulation to this area, specifically vibration or rhythmic pressure, you activate the pudendal nerve. And when that nerve fires, it sends a powerful signal to your brain that says, "Increase blood flow to the penis, now." Your brain responds immediately by triggering the release of nitric oxide in the blood vessels of your penile tissue. Nitric oxide is a vasodilator. It causes those blood vessels to relax and expand dramatically, and blood rushes in. That sudden influx of blood into the penile chambers is exactly how an erection forms. That's the biological mechanism. That's what's happening inside your body every single time. Now, let me back this up with research, because I never ask my patients to trust me blindly. A 2009 study published in the Journal of Sexual Medicine found that perineal nerve stimulation significantly improved erectile response in men with mild to moderate dysfunction. The researchers concluded that direct stimulation of the pudendal nerve enhanced vascular response in the pelvic region. In plain language, when you wake up this nerve, blood flows where it needs to go. And here's what I find fascinating as a physician. This isn't some exotic, complicated procedure. This is your body's own built-in response system. You're not adding anything artificial. You're not taking a drug. You're simply activating a pathway that already exists inside you. You're turning on a switch that's been sitting there, waiting to be flipped. Think of it like this. Your nervous system is like an electrical circuit. The pudendal nerve is the wire that connects your brain to your penis. Over time, due to age, stress, poor circulation, or inactivity, that wire can become sluggish. The signal gets weak. The connection fades. But the wire is still there. It hasn't been cut. It just needs a spark. And that's exactly what this technique provides, a spark. But here's the key, and I cannot stress this enough. Most men don't know where this spot is, or they press too hard, or they don't stimulate it long enough, or they use the wrong tool. That's why the toothbrush method works so beautifully. It gives you the exact right amount of vibration, in the exact right spot, with the exact right pressure. It's precise, it's gentle, and it's effective. Now, before I show you exactly how to do this step by step, I need to warn you about the most common mistakes that will completely ruin this technique. And listen carefully, because most men make these mistakes without even realizing it. And then they come back and say, "Dr. Jocelyn, it didn't work." And when I ask them what they did, I immediately find the problem. So let me save you that frustration right now. Mistake number 1, pressing too hard. This is by far the most common error I see. Your perineum is a sensitive area. The pudendal nerve sits very close to the surface of the skin. If you press too hard with your fingers, or if you use something rigid or aggressive, you can actually desensitize the area. You can numb the nerve instead of activating it. You can even cause discomfort or bruising. That defeats the entire purpose. That's precisely why a soft bristle toothbrush is the perfect tool for this. It provides gentle, consistent, rhythmic stimulation without overwhelming the nerve. It's not too much, and it's not too little. It's just right. And I know that sounds simple, but in medicine, the simplest interventions are often the most effective. Mistake number 2, doing it for too long. I've had patients tell me they sat there stimulating their perineum for 5, 8, even 10 minutes, thinking that more is better. It's not. Your pudendal nerve responds to brief, focused stimulation. 20 to 30 seconds is the sweet spot. That's all you need. Any longer and you risk overstimulating the nerve, which can cause it to fatigue and actually reduce your response. So please, trust the timing. Less is more here. Mistake number 3, doing it at the wrong time. This technique works best when you do it right before intimacy. I'm talking 2 to 5 minutes before you need to perform. If you do it 20 minutes ahead of time, the effect will have faded by the time you need it. If you wait until you're already in the middle of things and struggling, you've missed the optimal window. Timing is everything with this method. 2 to 5 minutes before. That's your golden window. Mistake number 4, and this one is subtle but critically important, doing it while you're stressed, anxious, or mentally distracted. If your body is in fight or flight mode, if your shoulders are tight, your jaw is clenched, and your mind is racing with worries about whether you'll perform or not, this technique will be significantly less effective. Your stress hormones, cortisol and adrenaline, actively work against the erection process. They constrict blood vessels instead of opening them. They redirect blood away from your genitals. So your mental and emotional state matters enormously, and I'll explain exactly how to address this when I share the bonus strategy in just a moment. Mistake number 5, giving up after one attempt if it doesn't feel dramatic. Some men expect an instant, rock-hard erection within 10 seconds. For some men, that does happen. But for others, especially if you've been dealing with dysfunction for a long time, the first response might be more subtle. A warmth, a tingling, a slight increase in fullness. That's still the nerve activating. That's still progress. I always tell my patients, give it 3 tries before you judge it. Each time, your nerve pathway becomes more responsive. Each time, the signal gets stronger. Don't quit after 1 attempt. All right, now that you understand the science and you know what not to do, let me walk you through the exact protocol, step by step. This is the part I want you to memorize, gentlemen. This is your new pre-intimacy routine. Step 1, find the spot. Sit or stand comfortably. Take your index and middle finger and place them between your scrotum and your anus. You'll feel a small, soft, slightly cushioned area. That's your perineum. It's roughly the size of a quarter, maybe slightly larger. That is your target zone. Take a moment to familiarize yourself with it. Press gently. You should feel a subtle sensation, almost like a mild tenderness. That tells you you're in the right place. Step 2, prepare your toothbrush. Use a soft bristle toothbrush. Not medium, not hard, soft. This is non-negotiable. And please, make sure it's clean. Ideally, use a brand new one that you dedicate specifically to this purpose. You don't want bacteria near sensitive areas, and you don't want to use the same brush you use on your teeth. Keep it separate, keep it clean, keep it stored in a hygienic place. Step 3, apply gentle, rhythmic pressure. Place the bristles of the toothbrush directly on the perineum. Press lightly, just enough to make full contact with the skin. You don't need to push into the tissue. Just rest the bristles there with light, comfortable pressure. Now, begin moving the toothbrush in small circular motions. Not scrubbing, not aggressive back and forth movements, just gentle, rhythmic circles. Imagine you're painting tiny circles on the surface of your skin. Smooth, controlled, consistent. You can also alternate with a slight up and down tapping motion, gently lifting the bristles and tapping them back down in a steady rhythm. The goal here is to create gentle vibration that stimulates the pudendal nerve without overwhelming it. You want to wake it up, not shock it. Think of it as gently knocking on a door rather than pounding on it. Step 4, duration. 20 to 30 seconds. That's it. I recommend setting a timer on your phone if you need to, because most men either rush through it in 10 seconds or overdo it for several minutes. Neither approach gives you the best result. 20 to 30 seconds is the scientifically supported sweet spot. Most men begin to feel the effect within 15 seconds, but I always recommend going the full 30 to maximize the neural response. Step 5, timing. As I mentioned before, do this 2 to 5 minutes before intimacy, not 20 minutes before, not during, right before. This ensures that the nerve activation is fresh, the blood flow response is at its peak, and your body is primed and ready. Now, what should you feel? Here's what most of my patients report. Within 10 to 20 seconds of starting the stimulation, you should notice a tingling sensation spreading through your pelvis. It's subtle at first, almost like a warm pulse. Then you'll feel an increase in blood flow to the genital area. Some men describe it as a heaviness or fullness. You might even start to feel the very beginning of an erection forming, and this is without any visual or mental stimulation. That's purely your pudendal nerve doing its job. That's your body's own response system coming online. And gentlemen, I want you to really hear this. That response is proof that your body still works. It's proof that the machinery is still there. You just needed to know how to turn it on. Now, this technique works beautifully on its own, but there is one bonus strategy that makes it significantly more powerful, and I would be doing you a disservice if I didn't share it with you before we finish. This is the piece that takes this from good to extraordinary. Here's the bonus. Combine this technique with controlled breathing. While you're doing the toothbrush stimulation, I want you to breathe slowly and deeply. Here's the pattern. Inhale through your nose for 4 seconds. Hold your breath gently for 2 seconds. Then exhale slowly through your mouth for 4 seconds. Nice and slow, controlled, rhythmic, like a wave rolling in and rolling out. Why does this make such a difference? Because deep, controlled breathing activates your parasympathetic nervous system. That's the branch of your nervous system responsible for relaxation, digestion, and, this is the important part, sexual arousal. Your parasympathetic system is the one that tells your body, you're safe, you can relax, you can become aroused. When you're stressed, anxious, or tense, your sympathetic nervous system takes over. That's your fight or flight response. And when fight or flight is active, your body redirects blood away from your genitals and toward your muscles, your heart, and your lungs. It's preparing you to run from danger, not to make love. That's why performance anxiety is so devastating to erections. It's not in your head, it's in your nervous system. So when you pair the physical nerve stimulation of the toothbrush with the deep breathing technique, you are activating two completely different but complementary pathways at the same time. You're stimulating the pudendal nerve to increase blood flow to the penis, and you're activating the parasympathetic system to tell your body it's safe to become aroused. The result is faster, stronger, and more reliable. A 2011 study published in Psychophysiology confirmed that controlled breathing significantly boosted physiological arousal markers in men. The researchers found that men who practiced slow, rhythmic breathing before and during arousal showed measurably stronger erectile responses than those who didn't. In simple terms, you get harder, faster, and the effect lasts longer. So here's what the complete technique looks like when you put it all together. This is your full protocol. First, find your perineum, the spot between your scrotum and your anus. Second, grab a clean, soft bristle toothbrush. Third, apply gentle pressure with small circular motions or light tapping directly on the perineum. Fourth, do this for 20 to 30 seconds while taking slow, deep breaths. 4 seconds in, 2-second hold, 4 seconds out. Fifth, do it 2 to 5 minutes before intimacy. That's the entire system. 5 steps, 30 seconds, 0 cost. No pills, no prescriptions, no awkward doctor visits, no side effects. Just your body's own built-in response system, activated the way nature intended. Now, I want to address something that I know some of you are thinking. You're thinking, Dr. Jocelyn, this sounds too simple. How can a toothbrush fix something that pills barely help with? And I understand that skepticism. I really do. But let me explain why simplicity doesn't mean ineffectiveness. The pharmaceutical approach to erectile dysfunction focuses primarily on one thing: chemistry. Pills like sildenafil and tadalafil work by blocking an enzyme called PDE5 that breaks down nitric oxide in the penile tissue. They're effective for many men, absolutely, and I'm not here to tell you to stop taking your medication. That's a conversation between you and your prescribing physician. But here's what those pills don't do. They don't activate the nerve. They don't start the process. They simply enhance the chemical response once it's already been triggered. In other words, pills work downstream. They amplify a signal that's already been sent. But if the signal is weak to begin with, if the pudendal nerve isn't firing efficiently, then even the best medication in the world has less to work with. What this technique does is fundamentally different. It activates the nerve directly. It starts the entire cascade at its source, at the pudendal nerve itself. For many men, especially those over 60 whose nerve conduction speed has naturally slowed down with age, this direct, targeted stimulation is the missing piece of the puzzle. It's the spark that starts the engine. Once the nerve fires properly and the signal reaches the brain with full strength, your body takes over and does the rest naturally. And here's the beautiful thing. This technique works alongside anything else you're already doing. If you're taking medication, this enhances it. If you're exercising and eating well, this complements that. If you're doing pelvic floor exercises, this amplifies those benefits. It's not a replacement for medical care. It's an addition to your toolkit. And it's one that costs you nothing and takes 30 seconds. I've seen this work for hundreds of patients in my practice. Men who had completely given up. Men who told their wives they would never be intimate again. Men who thought their best years were behind them and that this part of their life was simply over. Men who hadn't experienced a firm, reliable erection in 5, even 10 years. And the look on their faces when they come back to my office and tell me it worked. The relief, the joy, the renewed sense of confidence. That is why I do what I do. That's why I went into medicine in the first place. And that's exactly why I'm sharing this with you today, for free, on this channel. Because every man deserves to know about this. I had one patient, a 67-year-old retired teacher, who told me after trying this technique, Dr. Jocelyn, I feel like myself again for the first time in years. He had tears in his eyes. His wife later sent me a handwritten note thanking me. Moments like that remind me that medicine isn't just about prescriptions and procedures. It's about restoring dignity. It's about giving people their lives back. Bottom line, your toothbrush can do far more than clean your teeth. When you use it to stimulate your perineum for 20 to 30 seconds, combined with controlled deep breathing, you activate the pudendal nerve, flood your penis with blood, shift your nervous system into arousal mode, and prime your entire body for instant, reliable hardness. I know it sounds bizarre. I know it sounds almost too simple to be true. But the science backs it up, the anatomy supports it, the research confirms it, and thousands of men around the world have already proven that it works. You have absolutely nothing to lose and everything to gain. So here's my challenge to you. Try it tonight, just once. Give yourself permission to be surprised. Give yourself permission to hope again. And then come back here and drop a comment telling me exactly what happened. I read every single comment on this channel, and I genuinely want to hear your story. Your experience could be the thing that gives another man the courage to try this for himself. And if you found this video helpful, and I truly believe you will once you try it, please share it with a friend, a brother, a father, anyone you know who might be struggling silently with this issue. You never know whose life you might change with a simple share. Thank you so much for watching, gentlemen. Thank you for trusting me with something so personal. Take care of yourselves, take care of your health, and remember, your best years are not behind you. They're just getting started. I'll see you in the next one.